Candace Barnwell, and welcome to this presentation. I decided to do my practicum project on patient falls, since I believe that this is a very serious problem within the healthcare industry. My practicum goal is to design, implement, and evaluate the strategies to prevent falls in hospitals. Research deficits that 1 in 3 U.S. adults aged 65 or older fall each year. Approximately 10% of these falls occur in healthcare institutions. However, there are other falls that occur at home. Approximately 2% to 10% of hospital inpatient falls during the hospital stay. About 30% of the inpatient falls in hospitals usually result in injuries. Therefore, I believe that it is a very serious problem within the healthcare industry that requires quick intervention. My practicum project is aimed at coming up with strategies that could help reduce the number of patient falls in healthcare facilities. My project focuses on 3 learning objectives. All that I undertook within the period of the project was aimed at fulfilling these objectives. My first objective was to ensure that I conduct a literature review analyzing all the necessary strategies of mitigating patient falls in hospitals. The second objective of study was aimed at ensuring that I successfully implement an in-service program that I would utilize and train Riverside Regional Medical Center staff, specifically in the ortho department. The last objective was to ensure that I analyzed how effective the in-service training program was and the rate to which patient falls were reduced due to the training. Aiming at achieving the first objective of my project, I had to conduct a thorough literature review within the first week of the project. Since there are several studies that have been carried out in the same area, I decided to begin with reviewing the peer-reviewed journals. I reviewed a total of 10 peer-reviewed journals, not more than 5 years old. Secondly, I visited the Joint Commission website and reviewed their outlined guidelines and suggestion actions. Lastly, I searched for the current available legislation and statuses in different states that are aimed at preventing patient falls. I also visited several hospital websites to see what they do to reduce instances of patient falls in their facilities. During the second week, my entire focus was implementing the in-service training program and conducting the training within 3 days. I began the week by gathering all the necessary training materials. My major training material was a PowerPoint presentation, though I had some handouts. I also prepared the training schedule after visiting the Riverside Regional Medical Center and created a good rapport with the staff in the ortho department. We scheduled the training to be done in 3 days at the convenient hours of the staff members. After that, I met with the project mentor who approved my in-service program and gave me some helpful guidelines for training the staff. I conducted the training successfully within 3 days. After completing the training of the staff, all the other weeks of the project, I utilized evaluating how effective the training program was. Since during training, I recorded some of the questions that the trainees had and the answers they offered to the questions after the training. I evaluated these responses to see what extent did they understand. Additionally, I visited the ortho department several times to evaluate if the staff was complying with what I had trained them to undertake. Lastly, I kept a follow-up with the management to see how the training affected the rate of patients' falls in the department. There are several outcomes of the project that I achieved. First, I was able to come up with a list of 10 references indicating the achievements of the first goal. Additionally, completion of the primary goal was deficit by copies of Joint Commission regulations and suggested outcomes that I obtained from the Joint Commission website. I also came up with a detailed review report as a way of depositing the achievements of the first objective as an indication of the achievements of the second objective. I collected all training materials and presented them to my PM for approval. The achievement of the third objective, as indicated by a report that I developed detailing how effective the program was to the ortho department. Additionally, I also included the suggestions of further projects in the patient safety area in the report. In conclusion, this project made me realize that the implementation of patient fall prevention strategies is essential. The strategies are meant to ensure that there are only minimal or no cases of patient falls in our healthcare facilities. Additionally, I found that healthcare professionals, and especially nurses, have the greatest role to play towards the prevention of patient falls. Additionally, patients also have a role to play towards the prevention of patient falls. Thank you. And here are my references.